talk about medication adherence in this video. The extent to which a person behavior in taking medication is the medication adherence. एक हेल्थ केयर प्रोवाइडर द्वारा इंस्ट्रक्शन बताई गई किसी पेशेंट को, लेकिन वो किस तरह से उसको adhere कर रहा है वो पर्टिकुलर पेशेंट, वही medication adherence है. So there are different factors that affect the medication adherence. So there are 5 dimensions. Number 1, social and economic factors, healthcare system, condition related, then patient and therapy related factors. Number 1, social and economic factor that includes limited English language proficiency. मान लीजिए एक हेल्थ केयर प्रोवाइडर ने इंग्लिश लैंग्वेज में बताया कि आपको इस तरह से इंस्ट्रक्शन दी कि आपको ये जो मेडिसिन है वो इस तरह से लेनी है, लेकिन पेशेंट इज नॉट एबल टू गेट दैट बिकॉज ही इज इलिटरेट, ही इज नॉट हैविंग द नॉलेज ऑफ इंग्लिश लैंग्वेज. तो दैट कोज that affect the medication adherence. That low health literacy, lack of family or social support network, unstable living condition, उसका घर नहीं है पेशेंट का, homelessness, very hectic schedule of the patient, उसको टाइम नहीं मिल रहा है मेडिकेशन लेने का, lack of healthcare insurance, medication cost, etc. So these are the social economic factors. Number 1, the healthcare system. Number 2 is the healthcare system factor that include provider-patient relationship. So it is very important to maintain a cordial relationship with the patient, and it is the obligation of the healthcare provider to do that. Provider communication skill, this is most important. Disparity between the health beliefs of the healthcare provider and those of the patient. Then lack of knowledge on adherence and of effective intervention for improving it. Patient information material written at too high, बहुत ही high language में लिख दिया गया इंस्ट्रक्शंस को, पेशेंट नहीं समझ पा रहा है कि वो लिखा क्या गया है एक फिजिशियन द्वारा, और मेडिकेशन अडेयरेंस को 100% इन्फ्लुएंस करेगा. Condition related includes lack of symptoms, chronic conditions, severity of the symptom, depression, anxiety, mental retardation. In case of patient is having some mental problem, it include under the condition related factors, and that will affect the medication adherence also. Therapy related includes complexity of the medication dosage. बहुत ही मुश्किल या कॉम्प्लेक्स डोजेस रेजिमेंट तैयार कर दिया, पेशेंट नहीं समझ पाया, जिसकी वजह से डोज उसने सही टाइम पे या कुछ ना कुछ गलती हुई उससे, दैट अफेक्ट द मेडिकेशन एडहेरेंस. नेक्स्ट इज द ड्यूरेशन ऑफ द फ्रीक्वेंसी ऑफ द डोज, लैक ऑफ इमीडिएट बेनिफिट ऑफ द थेरेपी. एकदम से बेनिफिट नहीं हुआ पेशेंट को लगा कि इस दवाई खाने से बेनिफिट नहीं हो रहा है, उसने अडेयर करना छोड़ दिया. दैट कोज वेरिएशन इन द मेडिकेशन एडहेरेंस. And patient related factor include physical factor and the psychological. The psychological factors, the different beliefs of the patient also about the drug or disease. The knowledge about the disease, understanding reason medication is needed, lack of motivation, very important, fear of dependence, fear of possible ADR or side effects. Then psychological condition include stress, anxiety, anger, or alcohol or other substance abuse. And physical factor include visual impairment. अगर पेशेंट को hearing impairment है, visual impairment है और उसको cognitive impairment है, तो नेचुरल सी बात है पेशेंट मेडिकेशन एडहेरेंस में वो इफेक्ट करेगा. So there are different how to monitor this patient medication adherence. There are different methods like direct or indirect. The direct method include measuring the concentration of drug in the body simply. Second is the measuring the pharmacological response, and the indirect method include tablet counting, patient self-report, patient diaries, recording devices, refilling of prescriptions. So these are very important. Third one is the role of healthcare provider to improve the medication adherence. So what should a healthcare provider, pharmacist do? At the level of prescribing, there are different jobs and responsibility at the level of prescribing also. तभी पेशेंट को बताना है, एक हेल्थ केयर प्रोवाइडर या एक फार्मासिस्ट द्वारा इंस्ट्रक्शन दी जाएंगी. Communicating with the patient, very important during follow-ups particularly. And there are different ways to improve the compliance, like by ensuring the compliance, for removing barrier to the compliance, by simplifying the therapeutic regimen, and by educating the patient. So I think this is clear. So please, these 3 flowchart you have to do in case of medication adherence. So thank you all for valuable time.